Before we start, the content is not intended to be medical advice, and the viewers should consult their physicians should they have any questions. Viewers should not rely on information contained in this presentation for immediate or urgent medical needs. If you think you may have a medical emergency, call your physician, go to the nearest emergency department, or call 911 immediately. Never disregard professional medical advice or delay seeking care because of information contained in this presentation. Now, here without any more delays is Mark McDowell, licensed clinical social worker.
Thank you, Emma. And I'm here today to present on advanced directives. And I'm going to start with a scenario to kind of warm up and give us an idea of what we're going to approach here with advanced directives. So just think to yourself, if something were to happen to you and suddenly you were unable to make your medical decisions for yourself, would your doctor, would your partner or spouse, or any other close family member or friend know what you would want? What treatments would you accept or decline? What would be most important to you? And how would you want to live? The Patient Self-Determination Act of 1990 stated every competent adult has the fundamental right to self-determination regarding decisions pertaining to his or her health care, including the right to choose or refuse medical treatment. It goes on to say the intent is to ensure that individuals preserve the right to make decisions about their health care, even when they're unable to communicate those wishes due to incapacity. So I'm going to explain a little bit about advanced care planning in general. Advanced care planning is a dynamic process of recurring communication to plan for future medical care. And this includes learning about and understanding possible future events and situations and potential choices. Also reflecting on wishes, values, and goals of care, and also discussing those choices and plans with those who might need to carry them out. So what is an advance directive? A good explanation, a good standard definition, is that it's a witnessed written document or potentially an oral statement in which instructions are given by a person expressing their desires concerning any aspect of healthcare should they lose the ability to communicate those wishes. So who should have one? A lot of people automatically think someone who's got an illness that's in a medical situation that they're more, it would be more advantageous for them to have one. But actually, anyone over the age of 18 is really would be really beneficial to have one. A contrast to medical situations is auto accidents or accidents of any kind, where you may have a situation where you're incapacitated and unable to make your medical decisions. So it's a very, very versatile document. So I'll start with explaining a living will, which is a healthcare directive to provide direction to families and medical professionals as to a person's wishes regarding life-prolonging procedures or treatment for terminal conditions, end-stage conditions, or persistent vegetative state conditions. I usually like to explain a living will by contrasting it with another advanced directive document that's really known out there but maybe misunderstood, the Do Not Resuscitate Order, or it's called a no-code document. So I'll explain first, a Do Not Resuscitate Order is in the event that a squad is called to your home. If you've had a conversation with your doctor and you've put together and decided to sign off on a Do Not Resuscitate form, and in the state of Ohio, it's a large yellow piece of paper. It's on yellow bond and very distinct looking. It needs to be signed by you and your physician. What that document is that when a squad is called to your home, or if you at any point have a medical situation and a squad is called, they will provide all care as they would for anyone else without a DNR, but things will change if for some reason your heart was to stop or your breathing was to stop. At that point, they would not pursue heroics. They would actually stop at that point and provide comfort measures only. So that's an immediate document, and it has to be produced if a squad is called. So that's like a very upfront and immediate document. A living will, a lot of people think a living will is actually a do not resuscitate order. So I'll explain how it differs. I'll use an example. If I'm in a car accident and I end up in an emergency room, or if any of us were to end up in an emergency room without a do not resuscitate order, we would be treated with all the care, and we would receive all the medical treatment we would require. Now, if a physician in the emergency room felt that I needed life support equipment with the hope that I would improve at a later date, they would institute life support, potentially ventilation with a breathing tube, artificial hydration, nutrition. All of that would be introduced with the hope that I would improve over time. Now, if a week goes by, 10 days goes by, 14 days goes by, if it looks like I'm not improving, and if it looks like I haven't regained consciousness, I've slipped into either a permanent vegetative state, a end-stage condition, or a terminal condition, that triggers the two physicians to start a discussion about whether the life support needs to be withdrawn. So this is kind of a wait and see document down the road that at that point they would be talking with family. It's not something that would be done quickly. It has to be very deliberate, a discussion with family, and a lot of review process to see whether or not it's time to honor my wishes to be taken off of life support if I meet those three standards. So it's kind of a back-end document, whereas a do not resuscitate order is more of a front-end document. And I think that's a more useful way to contrast and understand how the two work. So the next part of an advanced directive is a designation of healthcare surrogate. And a healthcare surrogate is a very simple form that helps to identify who's going to be the primary decision maker in the event that you're unable to make decisions for yourself. It also allows for an alternative, and I believe now actually two alternatives. So in my situation, my wife is my primary person, but I think in terms of, well, if I was in a car accident and we were both injured and she couldn't be my decision maker, who would be the next person? So that's the importance of the healthcare surrogate. Now, there is also a durable power of attorney for healthcare, which is a larger form, also includes financial and legal information, and typically these are prepared by an attorney. We do dissuade people from getting generic forms from office supply companies. Florida law tends to be a little tricky, and it really does make sense to have the consultation of an attorney if you're looking at creating a power of attorney, a durable power of attorney. So it functions as a designation of healthcare surrogate. So it takes care of that part, but it also encompasses legal issues. So it's a powerful legal document. And it really, once again, should be completed by an attorney because it does need to be notarized. And there are a lot of complexities and that you may need to have your individual specific situation considered. The next category is a healthcare proxy. Now, this is in the event that you haven't completed any documentation. So it says when an incapacitated person has not executed an advance directive, the healthcare decisions will be made by a priority list outlined by law. And I'm going to follow with what that is. So a healthcare proxy is in the absence of any healthcare surrogate or a healthcare, a durable power of attorney. No documentation has been provided. So in the event that something happens and your physician needs to talk to someone else, you're unable to make your medical decisions, the following order or priority is as follows. First, it would be if you've had a legal guardian appointed for you, if you happen to be an older person or a younger person, and you have a legal guardian, that's the first priority of decision making. The next would be the spouse. The next, in the absence of a spouse, would be the majority of all adult children. The next line on the list would be the parent, any surviving parent, of course. The next would be a majority of adult siblings. The next would be any adult relative. And now we're moving towards, now we're talking about close friends. And what most of these, to explain quickly, they have to show a company, a medical establishment has to show due diligence to try to get in touch with one of these people. If it ends up being a majority of adult children, anytime there's a number of people that have to be consulted, they just have to show due diligence that they've made a real attempt to try to get in touch with those people. They are in situations sometimes where they're not able to get in touch with everyone. So they're going to actually show, they're going to be talking to who is available, who shows up for the patient. And that's how this happens with an adult relative or a close friend. It may be the only person available to that person to make decisions. So that's something to think about whether it's, worth your while to move on towards completing a healthcare surrogate, to be more specific about who your decision makers are. And the last on the category is a licensed clinical social worker. And I've never actually run into this situation, but technically, if there is someone who's in a medical situation and there is no one who shows up connected to the patient, there is a provision to appoint a licensed clinical social worker to step in. Now, if this happened to be a Moffitt patient, it couldn't be a Moffitt social worker. I could not be in that role because of a potential conflict of interest. So there is a mechanism to have a licensed clinical social worker from another agency involved in this to step in as a decision maker. So all of this is good to keep in mind. You may be thinking, maybe I don't need to do an advanced directive because I'm okay with this list, but there's always a potential of little problems that might pop up as time goes by. So I'd like you to consider completing advanced directives. I think it's worth your while. So to go forward with advanced directives, the intent is to guide decision making, but it only becomes active when a patient loses decisional capacity and is not likely to recover. Now, there are some situations for short-term periods where people may need to step in for decision making. That's also possible. And this document can be revised at any time, and the most current copy is valid. So something to keep in mind with this is, as your medical condition changes over time, it's a good idea to look over your advanced directive at certain intervals to make changes as your condition changes. Your wishes may change. Also, oral statements are valid. They just need to be documented. And the intent with this decision making is to make things portable, that this can go from one medical establishment to another medical establishment. It moves with you. So why are advanced directives important? Well, studies have shown that families often find it difficult to decide on whether to continue medical treatment, and if so, how much treatment, and for how long in an end-of-life crisis. So patients repeatedly also report that they do not want to be a physical or an emotional burden on their families. And also they're important to ensure that patients have the best chance of receiving the care that they would have chosen for themselves. The document allows you to speak for yourself in a situation where you're not able to speak. So additional benefits of advanced directives: studies have shown that patients who've talked with their families and or their physician about preferences for care, they tend to have less fear and anxiety. They tend to feel that they had more ability to influence and direct their medical care. They believe that their physicians had a better understanding of their wishes. And also, lastly, indicated a greater understanding and comfort level than before the discussion. It's an important conversation to have, not just completing the document, but just the whole discussion about wishes at end of life. Okay. Now, something to consider while you're doing and completing an advanced directive form is just the whole concept of communicating your wishes. Good communication is essential to understanding your values. to understand what's important to you and to understand what would give you good quality of life. So your surrogate, your family members, and other loved ones, including your doctor, should know about and be able to honor your advance directive. Because it's impossible to predict all potential scenarios, it's best that your values and preferences are known through discussions with loved ones and your doctors. Often the real value of an advance directive is the communication, the discussion with the family about what you would like as you move into situations where you may be towards end of life and unable to make decisions. Once again, you may not be able to predict every potential scenario, but the conversation gives your family a sense of what you would want in a difficult situation. So another thing to consider is questions you may want to ask your doctor. Now, something to consider here right now, if you're in a situation right now where you're a fairly healthy person, the questions you ask your doctor may be fairly general because you're not really thinking about a health condition that you have or some situation that may be coming, that may be on the horizon. So the conversations with your doctor about your advance directives may be a little more minimal. But say you were diagnosed with a condition and there is something that may be life-limiting that's coming on into your situation, what questions would you ask your doctor at that point? So a good question is, will you talk openly and honestly about my values, my expectations, my wishes, and my goals for my healthcare? Another good question is, what decisions will my family and I have to make? Another is, what kinds of recommendations will you give to help us make decisions? Also, will you support and honor my values, goals, and wishes as expressed? And lastly, what will you do to ensure that I do not have pain or other uncomfortable symptoms? This is just a good beginning point to start with your physician, just to get a little more information and also to communicate. So questions you may want to ask who you choose to be your healthcare surrogate. A good question is, are you willing to be my healthcare surrogate and make medical decisions for me when I'm no longer able? Will you be able to make decisions for me even if they're not what I want? Or excuse me, if you, let me start that all over again. Will you be able to make decisions for me if they are what I want, even if they're not what you would choose for me? And lastly, will you be able to ask the doctor for more information if you don't understand treatment? These are all good questions to ask. Now, there are questions you may want to ask a loved one. Will you seek out information about my illness, what to expect, any advance directives that may be completed, and your role as a caregiver? Will you respect my wants and needs, even if you don't agree with my choices? And if I can't communicate for myself, will you speak for me to make sure that I have that what I have asked for is done, that you can help to execute what my wishes are? So it all comes back to, what questions do you want to ask yourself? So what matters to me is, what are your values? What matters to you when you complete your advance directive? And if at this point right now you're not quite sure, then this, I think, is good for more discussion to clarify what matters most to you. Start asking questions. So now the question becomes, what do you do when you complete an advance directive? Unfortunately, there's no central depository for advance directives. There's no place to put them on record where they would be generally accessible by any healthcare provider. So what we suggest is you, of course, keep the original. You make sure that it is accessible to your family or any friends, anyone. And you make copies then for your healthcare surrogate, for your loved ones, for your caregivers, for your doctors. Here at Moffitt, we'd like to have a copy, and we can put that into your medical file. So this is the thing to keep in mind, is that if you were out of state, for instance, most of us don't travel with our advanced directives, although if you had a medical condition that was maybe more of a concern and you might consider that you might have to ask for medical treatment while you're out of the area, it's a good idea to carry it. But if not, any medical provider wherever you travel can access usually your primary care or other family members to determine if you have an advanced directive, and that person would then produce it for any out-of-state situation. And also to consider now updating the form. I mentioned this before. The most current advanced directive is the one that's actually active and the one that will be followed. So it's an idea to kind of think every decade, every 10 years, to look at your advanced directive and see if it needs any updating. If you undergo a divorce, that's a good time to review your advanced directives. If you've received a new diagnosis, that's a good trigger as well. And if that includes the potential for decline or death of a loved one, that all needs to be figured in as well. So each of these categories are triggers to really consider whether or not you have to look at and review and potentially make changes to your advanced directive. So I'd like to end at the end with a thought here. An advanced directive, please consider it a gift that you give to yourself and to your loved ones to simplify things, to help your family in a situation where they may have to step in and make decisions for you. And of course, they're wanting to do the right thing. It's best to have the discussion prior to the situation. So where can you get help here at Moffitt? Feel free to contact the Social Work and Chaplaincy Office at 813-745-8407. We're also located on the Diamond at Mount Carmel, at MCC. All social workers at Moffitt are trained in advanced directives, and all of them can assist you. So thank you very much for your help, and thank you for your time.